Now coming to the non-thermal burn injuries. Non-thermal burn injuries, as far as the skin is concerned, everything happens like the burn. But it is not exactly caused by fire, heat or scalds. So the causes of non-thermal burn injuries can be electrical injuries, chemical injuries, ionizing radiation injuries and cold injuries. First we come to the electrical injuries. The electrical injuries can either be a low tension injury or it can be a high tension. It can be due to a high tension injury. So low tension injuries, low electric tension can be due to the domestic appliances and high tension can be due to the wires or lightning like that. So in one we can see the tetany and the patient is not going away from the wire and the other the patient gets uh, fall away from the high tension wire. So these are two types of electrical injuries. Now coming to the low tension injury. One is it can cause a mild damage. Low tension injuries and domestic injuries will generally cause a mild damage. There will be an entry wound somewhere in the hand and we can see an exit wound. So there will be an entry wound and an exit wound. So how does the entry wound and exit wound happens? In electrical injury, suppose the patient is in contact with a domestic appliance. The current passes from the entry point to the exit point like that. So at the point where it is in contact with the bulb, maximum electricity flow, so there will be an entry wound. And where it exits out, there will be again maximum contact at the earth point. So there will be an exit wound. So entry wound and exit wounds are classical of electrical burns. The current will be alternating current in low tension injury. It will be generally a domestic appliance. And when we remove a patient from a low tension injury, make sure that we use some rod which is non-conducting because otherwise, due to the tetany and due to the alternating current, there is a chance for the rescuing person to also get a shock. That doesn't happen because in the high tension injuries because that person will become ejected from that place. Now, these injuries can result in cardiac pacing. The sinus rhythm can be affected and the patient can go in for arrhythmia. And there will be also tetany in case of low tension injuries, muscle tetany. Now, what happens in high tension injuries? Is the mechanism same? No. In high tension injuries, it can be the says a high tension wire, overhead high tension wire. It can be due to the flash. The electric current may not can also pass through the air around the patient. Can also pass through the air around the patient. So this passage of air will heat up the air surrounding the patient, and that will cause a flash burn. That will cause a flash burn over the skin of the patient. Next is this heated air can sometimes uh, catch a fire in the dress of the patient and that will result in the flame burn. By the dress can get catch fire and it will cause the routine thermal burns or flame burns. And the next aspect of the injury is the current which is passing through the patient. The current which is passing through the muscle, the nerves and tendons and the heart of the patient can cause the burn injury also. So when this it passes through the muscle, what happens? There will be muscle destruction, muscle edema, and there will be compartment syndrome. And as a result of that the patient can go in for an amputation. This muscle destruction when results in the release of myoglobin to the circulation and result in myoglobinuria. And the myoglobinuria can further lead to renal function impairment. The next aspect is the myocardial damage. In the low tension injury, we heard that it is the rhythm which is affected. In this, the proper cardiac muscle will get damaged and the cardiac enzymes will be elevated and there will like an acute MI, the cardiac enzymes will be elevated. The CPKMP and the tropi can be elevated. So in electrical injuries, so for this reason, in electrical injuries, rather than the surgery people, first the medicine people has to come into the place. Because the cardiac problem is whether it is a low tension injury or a high tension injury, for the medicine, the internal medicine should have a look on the patient and see for the cardiac arrhythmias, and then only after treating the cardiac problem only the surgeon has to get involved. The primary should be by the medical people, especially in case of an electrical injuries. Now, the treatment of the electrical injuries, we have to maintain the urine output. There will be myoglobinuria, there is high chance of renal failure, so there should be adequate hydration. Acidosis, due to lactic acidosis, the muscle destruction, there will be acidosis will be there, bicarbonate should be given. Amputation, in order to avoid the reperfusion injury and renal failure, in order to avoid the compartment syndrome, amputation may be required. Now, heart failure has to be treated in case of a high tension electrical injury, and the arrhythmias can also be managed. Next is the chemical injuries. Chemical injuries can be either by alkali or an acid. This is an acid burn. So, two aspects of chemical injuries. One is the physical skin destruction. Next is the poisoning due to systemic absorption. We can see the physical skin destruction here. So, we have to lavash the chemical immediately. We should not pour alkali or acid to neutralize it because there will be a reaction and there will be increased thermal burn. So we have to lavash the chemical immediately and we have to identify the chemical whether it is an alkali or acid. Water can be used in lavash in almost all the chemicals, especially maybe in if it is a phosphorus poisoning or phosphorus or it is an elemental sodium, water should not be used. Rest all those cases, water can be used for lavash. Now, alkali, mind you, alkali is destructive than acid. Acid forms a thick eschar. Acid, when comes into contact with the skin or mucous membrane, it will form a thick eschar and it will not go further deep down. So, generally, acid injuries are comparatively superficial. But what happens is alkali dissolves and go deeper and deeper and result in deeper burns. One common acid which is of industrial use is hydrofluoric acid. It is associated with the fluoride toxicity. In those cases, there will be hypocalcemia and calcium gluconate gel has to be applied or it can be given as a Bayer's block to the affected part of hydrofluoric acid. That is regarding the chemical injuries. Now coming to the ionizing radiation injury. Ionizing radiation injury can be either due to high exposure to X-rays due to diagnostic medical imaging or during radiotherapy for cancer treatment, or it can be due to atomic bomb explosion or industrial accidents like that. Now, if the ionizing radiation is a local area is only affected, generally the patient going for a conservative management and excision of that area and grafting can be done. But if it is a systemic or a whole body radiation, things are difficult because the ionizing radiation injury can cause a multifaceted problems like including gut mucosa, edema, skin desquamation, immune system problems, malignancies later on. All these are factors of ionizing radiations. So it is difficult to manage whole body radiation. Now coming to the cold injuries. Cold can also cause injury to the skin. It can be either due to industrial accidents like that where liquid nitrogen can result in industrial accidents. So it can be either an epidermal burn or a dermal burns. Mind you, but our human tissue is more resistant to cold than heat. And delayed surgery is only required in case of a cold injuries. We have to make sure how much skin is actually involved because the tissue is more resistant to cold and then only do a surgery. Next is frostbite. That is when we go out, the exposed areas can be exposed to cold in cold countries and result in frostbite. So there can be microvascular damage. One is microvascular damage due to the cold and there can be reperfusion injury. So later on the frostbite area can be gangrenous like this in certain cases. So the treatment is rapid rewarming of the frostbite area and generally the management is conservative. We don't have to go for an aggressive management. Now in brief regarding the burns, we have gone through an introduction regarding all the specialties. Whichever specialty you are, we have to go through a burns patient. Then pathophysiology of burns regarding the respiratory, circulatory, microbial and GIT systems involved by the burns. Emergency burn care, the ABCD management of burns. When to admit the patients, when there is a medico-legal issues, when the burns are involving the thick skin or the face or the extremes of age we have discussed. Then we have discussed regarding the inhalational burns, the different the chemical pneumonitis, the deeper burns, the burns around the oral cavity, how to identify and treat them. the burns percentage calculation, the rule of valleys, and the Lund-Browder chart, depth of burns assessment, and the different responses of the different depth of burns having different treatment outcomes, fluid resuscitation in burns, the Parkland formula, nutrition in burns. Then we have discussed about the infection in burns and how to prevent and treat the infection in burns, identify and treat infection in burns. Then we have regarding the different aspect of the surgery in burns, how to manage an outpatient burns, and finally we have discussed about the non-thermal burn injury. That is regarding burns. Thank you.